Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 Homeopathic Remedies for Scarlatina. What is Scarlatina? Scarlatina or scarlet fever is generally manifested with a combination of rash, fever, 101 degree Fahrenheit or more, and sore throat. Test for Streptococcus A confirms the diagnosis. It is a Group A Streptococcal disease. What are the most common prey? Who are the most common prey of Scarlatina? Children between ages 5 and ages 50. Children between age 5 and age 15 are the most common prey. What is the cause of Scarlatina? Bacteria Streptococcus A is the causative organism of Scarlatina. How does Scarlatina spread? It's spread by 3 methods. Number 1, respiratory droplets. Number 2, direct method. Number 3, rarely through foods. Now look at the common symptoms of Scarlatina. These eruptions along with Scarlatina fever. Scarlatina fever tongue. This is the tongue. Either it is strawberry tongue or white coated. This is healthy tongue. This tongue is healthy tongue. This is strawberry tongue or white tongue. These two tongues may be there in the scarlet fever. What are the common signs and symptoms of Scarlatina? Fever and chills, sore throat, pain when swallowing, red rash. It is called telltale symptoms. On the right hand side, look at the picture of the baby. This is red rash, and it is also known as telltale symptom. That is, the confirmatory symptoms appears after 1 or 2 days illness begins. Rash gives a sandpaper like feeling on touch, headache, body ache, stomach ache, nausea, vomiting. White coating on tongue, already shown before early. Then finally strawberry tongue. Both the picture have been shown earlier. Intense red throat, red and swollen tonsils with streaks of pus, petechiae, tiny red spot on the roof of mouth, swollen lymph node in the front of neck. Who are predisposed to Scarlatina? Children between age 5 and 15, parents of school-aged children. How can Scarlatina be prevented? It's a fact that there is no allopathic vaccine to prevent Scarlatina. However, there are ways to minimize chance of infection if following steps are followed. Cover mouth and nose with a tissue when you cough or sneeze. Cough or sneeze into your upper sleeve or into elbows if you have no tissue. Wash hands with soap and water or alcohol-based hand rub for at least 20 seconds often. Strictly observe rules for personal hygiene like washing hands and face thoroughly before taking foods and drinks, wear mask, etc. One can take Scarlatinum. 200 once in a week for 3 consecutive weeks. Scarlatinum is a well-known and effective homeopathic vaccine against Scarlatina. In the market, there is no other vaccine. That is a strange thing. Scarlatinum was invented hundreds of years ago. It is a homeopathic vaccine, but as in case of all medicines, there is no clinical proof. So a lot of persons do not do not agree to this word that it is a homeopathic vaccine. But we homeopathic practitioners have noted that this is a nice remedy. And it can be dependent. One can depend on this medicine. Yes, it is a medicine as well as a preventive medicine for Scarlatina. When to see a doctor in case of Scarlatina? In case of Scarlatina, always consult a good physician as soon as possible, because Scarlatina, if left alone untreated, may pose a serious problem leading to many types of chronic complications. Now, what are the chronic complications that are given below? Rheumatic fever, glomerulonephritis, septicemia, osteomyelitis, pneumonia, otitis media. Discussion about treatment with homeopathic remedies. Ailanthus gland for Scarlatina. Unconscious, severe headache, severe vomiting, swollen throat, bluish or blackish eyes, eruptions less, acrid nasal discharges, face red, warm. Dangerous state of the disease. The disease in a dangerous state. Give Ailanthus 30 twice a day. Phytolacca for Scarlatina. Throat symptoms like pain, swelling, burning with enlarged glands, very much conspicuous. Give Phytolacca 30 3 hourly. Arsenic for Scarlatina. Eruptions suppressed before fulminating. Face pale, severe weakness, fear of death, restlessness, crave for warmth, thirst for a little water frequently, body cool. Give Scarlatina 30 3 hourly. Aconite for Scarlatina, used in this first stage of the disease. Intolerable inflammation all over the body, restlessness, fear of death, arm hangs down powerlessly, numbness of left arm, tingling in the fingers. Give Scarlatina 3x 2 hourly. Sorry, Aconite 3x, not Scarlatina. This is Scarlatina is the name of the disease. Give Aconite 3x 2 hourly. Cutellash horror for Scarlatina. Severe ulceration in throat, neck gland swollen, face looking toxic, with uneasy and restless feeling in the limbs, constant irregular motion of the left arm, some sort of chorea, that is involuntary movement. Hands tremble while writing. Give Scrotella sorida 4 hourly. Belladonna for Scarlatina. Pulsating pain in head, grinding, tearing, cramping pain anywhere in the body with high fever, worse from touch. Also acts as a preventive remedy. Mind it, Belladonna is also a good preventive for Scarlatina. Give Belladonna 3x 2 hourly. Lachesis for Scarlatina. Troubles aggravate after sleep. Generally left-sided affection. Patients talk much. Give Lachesis 30 8 hourly. Sulfur for Scarlatina. Whole body bright red, burning sensation, crave open air, drink little, eat much, leave bed early in the morning to pass stool. Use sulfur 30 4 hourly. With this, the video ends. Thanks for listening, viewing. If you face any problem, write down in the comment section. I would certainly attend.